Thank you for joining us. Thank you for joining Dr. Rogers and I in this Ask the Docs web series. It's not a webinar, it's a question and answer series. And we do this every first Wednesday of the month. And Dr. Rogers and I do this session to answer questions on most common orthopedic conditions and on innovative treatments like platelet-rich plasma and cell-based therapies. So our topic for this afternoon is golfer's elbow and tennis elbow, one of the most common orthopedic conditions that we see in our clinic. And so before we start discussing about the topic, I just want everyone to know if you are joining us on Facebook, you can go ahead and type in your questions under the comments section. And if you're joining us on Zoom, there's a Q&A button at the bottom of your screen and you can start typing your questions and we'll answer them as they come. If your questions are more of a personal nature, we would prefer that you call us or you email us, admin@sdomg.com, so that we can talk about your condition in more detail. All right, without further delay, I want to introduce Dr. Rogers, who will be joining us, and he'll give us a brief description on what a golfer's elbow is and a tennis elbow is before we start with the questions.
Thank you, Dr. Ambach. So actually, the golfer's elbow is something that's very near and dear to me for a lot of reasons. Not only did I suffer from it myself, being a golfer, or at least someone who plays golf. I don't know if I call myself a golfer, but the first time I ever learned about cell-based therapies, PRP and stem cell therapies, was through a friend of mine who is one of the top golf instructors in the world, who suffered from tennis elbow. And he came to me and he said, I have tennis elbow and I need PRP. And I asked him, I said, do golfers really get tennis elbow? And what the heck is PRP? So this was about 13 years ago. It was very new. He knew about it because his athletes were going to Europe and getting these treatments. So let's first by asking the question, what is tennis elbow? What is golfer's elbow? So we're talking about the symptoms where patients will get pain either on the outer side of the elbow or on the inside of the elbow. And if you squeeze your elbow, you feel there are bones there, and attaching to the bones are your tendons. Your tendons are fibrous tissue. They're made out of collagen and water mostly, and they have a few cells in them. Those cells manufacture the collagen that gives your tendon its strength. It's interesting to note that tendon, pound for pound, is as strong or stronger than steel. So it's a very strong material, but it's biologic and is prone to break down with repetitive use. Common uses would be in golf or tennis, where you're gripping a golf club or a tennis racket, where you're putting a lot of stress on the muscles in the forearm. All these muscles attach to the bones through those tendons. And with repetitive use, those tendons will break down. Tendons in general have trouble healing because they don't have very good blood flow. And like I said, they don't have a lot of cells in them. And so as we age, as our cell counts go down, those tendons have a harder and harder time recovering from the repetitive stress of golf or tennis. Typically, we describe pain on the outer side as tennis elbow, pain on the inside as golfer's elbow. But just like my friend, who is an avid golfer and very good golfer, his pain was on the outer side. We call that tennis elbow, but golfers get tennis elbow, and tennis players and pickleball players now also get these conditions. We diagnose them first of all by an examination of your strength and your motion in the elbow, but then also we will look at the tendons with ultrasound. So just like you can look at your babies with ultrasound, we can look at the tendons and we can see if they're injured. And they basically come in three flavors. A mild injury would be like a tendinitis, so the tendon is swollen. There's fluid in the tendon. There may be some microscopic tearing of the tendon. That could then progress to become more of a moderate type of condition where we would have an actual tendon tear. And these tendon tears come in small sizes. They're generally around 2 to 4 millimeters in size, these tears. So they're very small, but they are very painful. And then when they're very severe, they can take up, in some cases, we've seen cases where the tendon actually pulls off the bone. Those are very severe, and some of those will require surgery, although we've had some success treating very large tears with cell therapy as well. Now, platelet-rich plasma is something we've talked about a lot on this webinar, and go ahead.
Sorry to interrupt, Dr. Rogers. I just wanted to point out an important thing that Dr. Rogers has discussed. There's a difference between a tendinitis and a tendinopathy. So when you say tendinitis, that means there's inflammation in the tendon, which is the connection between your muscle into your bone. When we talk about tendinopathy, that's more of a chronic degenerative process wherein there's micro tearing in the tendons, there's loss of mechanical integrity into the tendon, and eventually the tendons get thicker, they become weaker, and they can cause chronic pain. So the tendinopathy is more of a chronic injury. And you can still have tendinitis when you have a chronic tendon injury, but there's a difference between the two, because we get that question a lot from our patients. They see tendinopathy on MRI and they ask us, what is that and how is that different from tendinitis?
Yeah, and traditionally we used to think that everything was tendinitis, which would mean that we assumed that everything was inflamed. And the definition of inflammation means that your immune system, your white blood cells, have migrated into the tissue. And what we've learned is when you biopsy those tissues, more often than not, that's not the case. It's not a true tendinitis. It's not a true inflammation. There aren't any white blood cells working their way into the tendon. What you see instead, like Dr. Ambach was saying, is a degenerative process where you're breaking down these collagen fibers, you're breaking down the tendon, you're not regenerating it quickly enough to restore function. And so, and that's important. Why? Because in the past, doctors would inject cortisone thinking that they would suppress the inflammation. And even though there are a few studies that show that cortisone injections can help temporarily alleviate the pain, really in most cases, they don't provide long-term benefit. And there's even some evidence that injecting a tendon with steroid is a bad idea because it harms the tendon cells and impairs their ability to regenerate tendon. So even though you may get a short-term pain relief, you really don't get a long-term solution, and you may actually be harming the tendon. So we don't really inject steroids in the tendons anymore, although I'm aware there's some doctors that still do that. But that's generally not considered standard of care anymore. Standard of care would be things like physical therapy for strengthening. Of course, you know that strengthening will make your muscles bigger and stronger and thicker, but you may not realize it also makes your tendons thicker and stronger. Tendons respond to stress. If you stretch them, they grow better. Interestingly, things like laser or electromagnetic fields or ultrasound, different types of electromechanical energy, electromagnetic or mechanical energy, can stimulate cells to produce more collagen. And so we try that first. And then if it's one of these tendons that's just having a hard time to heal, and we can see that on the ultrasound, we bring you back 4 weeks, 5 weeks later, and it's not healed, then we might offer you a cell therapy, which we've had very good success with. And in the published literature, we have extremely good support for platelet-rich plasma for tennis elbow. There have been a number of studies that have compared the injection of cells from your own blood, platelet cells, into the tendon, comparing that to patients who've had steroids or something else injected into their tendon. And we have again and again evidence that these platelet-rich plasma injections are effective and safe and provide long-lasting benefit. One of the most impressive studies I saw was actually by a hand surgeon who compared his results with surgery, where he would go in and cut away the damaged tissue and debride the painful tissue, versus those patients that he injected with PRP. And he had the same results. He had the same results at 1 year. His patients were just as happy whether they had had surgery or whether they had PRP. Obviously, an injection is a lot less invasive, a lot less risk than a surgical procedure, a lot less cost. So this is an alternative for most of our patients to consider.
Right. So just for those of you who are not familiar with cell-based therapies, there's two regenerative treatments that we do in the clinic. The most common that we do is PRP, or platelet-rich plasma, and that involves a concentrated amount of platelets that are derived from your blood. And we're interested in these platelets because they have thousands of growth factors that are involved in healing. They help regenerate tissue. They decrease inflammation. They help with the pain. They help with healing the tendon tears. And they also stimulate other cells, important cells that are involved in healing, to come into the area to jumpstart the healing process. The other group of cells that we use to treat orthopedic conditions in the clinic is cell-based therapies. And these are cells that are derived from either your bone marrow or your fat tissue or adipose tissue. And these tissues contain a different set of cells called adult stem cells, or more specifically mesenchymal stem cells. And these cells are very unique in that they not only have the ability to renew themselves, but they also have the ability to turn into other cells that's needed by the body. Let's say you have a ligament tear and you need, so they can turn into a ligament cell, or if you have a muscle injury, they can turn into a muscle cell, etc. So as Dr. Rogers was saying, there are a lot of studies on using platelet-rich plasma specifically for tendon injuries in the body. And there's high quality data to support its use for tennis elbow, gluteal tendinopathy, which is the tendon injury in your hip area, and also in the plantar fascia. But there's also other studies that shows its use for the other tendon injuries like rotator cuff injury or patellar tendinitis. And also for cell-based therapies like bone marrow and adipose, there's also high quality studies supporting its use for rotator cuff tears and tennis elbow as well.
Yeah, and so one question you might ask is, well, when would you use a PRP versus a cell therapy from fat or bone marrow? And you have to understand the biology of the injury. So if you have a mild injury, a mild tendinosis where the tendon is simply swollen but maybe doesn't have a lot of tearing in it, or if you have a case where there's a tear but it's a very small tear, we know that in those injuries, those injuries that haven't been there for very long, maybe it's only been 6 months or a year, we know those tendons still have a lot of cells in them. They have tendon cells, it's called a tenocyte. There's a specific tendon cell. There are also stem cells in the tendon, living in the tendon on the blood vessels. However, if the injury has been there for a long time, or if it's a very large injury, you will deplete your source of stem cells and tendon cells in the tendon. So the way PRP works, as Dr. Ambach just explained, is it releases growth factors, things like transforming growth factor beta, VEGF. There's hundreds, if not thousands, of these molecules that wake up the stem cells, wake up the tendon cells, turn on certain genes so that the cells make more collagen fibers, grow blood vessels, all the things you need to heal that tendon. Those cells, if they're depleted in a chronic or large wound, aren't there to be activated by the PRP. So in those cases, we would then have to supplement the tendon with these healing cells, these mesenchymal stem cells. And they're found everywhere in the body. And fortunately, they're abundant in fat. So we love taking a little bit of fat out of the waist area. It's a simple liposuction procedure, just takes a few minutes. And then we rinse it and wash it. And then we put those cells into the defect in the tendon. And we've had some amazing, I wish we could show you the pictures, but we've had some really amazing cases where you see a large tear on the ultrasound, and then 3 months later, it's completely gone. The tendon has completely healed itself. And it's very
have those, Dr. Rogers, we have those before and after pictures in our YouTube channel, Instagram and Facebook as well. So we try to post before and after pictures of our patients. Well, not our patients, but the injury where we treated, to educate you and to let you know what happened after the treatment.
Yeah, and the exciting thing is these treatments can be used in virtually any tendon in the body. So we treat, hips, shoulders, ankles. So the biology is similar throughout the body. So, but we're focusing on tennis elbow. We didn't really cover a lot of the things we try before doing cell therapy. You may be familiar with these straps that people wear, these braces. The purpose is just to redistribute the force so that there isn't so much stress on the tendon, so you can continue to play golf or play pickleball or tennis without feeling pain. Of course, that doesn't solve the problem. It's just alleviating the pain. Things like anti-inflammatory medications, Tylenol, pain medications, again, they're just Band-Aids. They don't really solve the problem. Sometimes, we give them credit for healing the injury when in reality it was just your body going through the natural healing process, and the medicine was just alleviating the pain while you were going through that process. But for those patients who don't respond to the more conservative treatments, which is actually a fair number of folks, we found these therapies to be extremely effective.
One of the most common questions that we get asked is, when do I start to see the benefits from these injections? These therapies are not like cortisone injections wherein you get the shot today, you feel great in the next day or two. In fact, you'll probably feel a little worse for the first few days while your body undergoes what we call an inflammatory phase, which is an important part of your healing process. But typically, patients start seeing some benefits maybe as early as 1 month after the injection. But most of our patients typically see functional improvement and increase in strength at about 3 to 4 months after the procedure. And that's also about the time wherein we can see some improvement in the ultrasound with regards to fiber growth in those areas that had the big tear.
Yeah, this is a good place to bring up the point that these cell therapies are extremely helpful, and they initiate a healing process in an area where the body's had trouble healing. But we can augment the response by adding a physical therapy protocol to the rehab process. And so you have to understand that when a tendon heals, the first phase, as Dr. Umbach described, this inflammatory phase. Anybody who's ever had a paper cut or any kind of injury to their skin, you notice within a day or so this little redness around the cut. That's because those platelets that were released into the wound called stem cells and other cells into the areas, and they also cause the blood vessels to dilate. So you get this redness and the swelling as you get this fluid and cell shift into the tissue. That will maybe last 10 days to 14 days, and then you'll get into this regenerative phase where cells start manufacturing more tendon. They start, the cells start to proliferate, multiply. You may grow new blood vessels, all these really interesting biologic effects that occur. And that process could take, another 6 to 8 weeks. And then once you have some good, healthy tendon in there, it's very thin, it's these spindly little collagen fibers. They need to mature, just like a plant. You think about a plant, you get these little sprouts, and then over time, they become thick branches. So it's the same with the collagen fibers in the tendon. They get thicker over time, and that remodeling process can take up to a year. But most of our patients do feel improvement probably within 6 to 8 weeks, like you were saying, sometimes as long as 3 months for some, depending on the degree of the injury.
So in relation to those phases of healing, we can answer this question with regards to one of our physical therapists is asking, if we like the tendon to be stressed with stretching or strengthening. And as Dr. Rogers has described the different phases of the healing process, while your body is going through this inflammatory phase, usually this is the phase wherein you do some range of motion exercises or just light stretching exercises. Once your fibers start organizing or start proliferating, that's when you can kind of guide it with proper exercises to help heal it in the right direction. And you can start the strengthening exercises as early as late second week. It all depends on how the patient feels. Obviously, every body heals differently. Some patients have inflammatory phase that can last for 2 weeks. So that's where the physical therapies is very important in the success of our therapy. I always tell my patients, your follow through is as important as the injection that I'm doing. Your physical therapist is as important as my role in getting you better. But that's very important to do those strengthening exercises even months after the injury.
Yeah, and even once you regain normal function and your tissue is healed, that tendon is healed, we like folks to engage in a maintenance program, and not to get too beyond the scope of this short webinar, but physical therapy is more than just growing tissue and strengthening tissue and improving range of motion. It's also about how does the entire upper limb function, right? So there's a reason why that tendon broke down. It might have broken down because your shoulder range of motion isn't as good as it could be, or it might have been a strength issue in your forearm, or it might have just been an overuse. We have to assess, and that's a very important part of our treatment, is to identify why the injury even occurred in the first place, because we need to address that root cause if we're going to avoid this happening ever again. And a lot of times physical therapy is the answer with regard to the root cause. And, this is true of any injury. The body has this remarkable ability to heal itself, thank God. Otherwise, we probably wouldn't live beyond, kindergarten. But unfortunately, as we age, we use up some of these cells. Our circulation isn't as good as it was. There's a variety of variables that influence our capacity to heal. And so for those injuries that, probably many of you have had pain, and then it got better on its own, but then maybe it came back later. Even though the pain had gone away, the injury didn't fully heal. It's just that you weren't feeling it. So the fact that it came back tells us we need to take a look and figure out why is it not healing completely. And so physical therapy and cell therapy are really instrumental in making sure that you're completely healed.
Right. And this is what tendon injuries are basically in general. They are a failed repair process from the body. Your body is very smart. Every time you have an injury, it will try to repair itself. But as Dr. Rogers has mentioned, tendon injuries are very common because they just don't have a great capacity to heal. They have decreased blood flow in those regions, and they're a constant areas of stress just from daily activities. You're always using your muscles. Even if you're just standing, you're using your muscles. So that's when we start to think about other treatment options that can actually make your tendons stronger. And that also plays into part with regards to what your goals are. We have patients that come in here that just want the pain relieved. But most of our patients come in here to try to heal the injury because they want to go back to playing golf or go back and play with their grandchild and run around with their grandchild. So it really depends on the level of activity that you do on a daily basis and what your goals are. And with most of our patients who wants to return to active living, this would be a great treatment option for you because it's more of a long-term treatment option rather than just masking pain and inflammation. So another question, Dr. Rogers, we're talking about PRP and stem cell therapies. One of the questions that I see here is, are these therapies safe to use in my tendon injuries?
Yeah, great question. First of all, are the cells safe? Well, obviously they're your own cells, so you're not going to have an allergic reaction to it like you might to a drug. There's no risk of disease transmission. We're not using cells from another person's body. We're using your own cells. You can see I'm in a lab here. The reason we developed the lab the way we did, if you look over here to what I think is your left, there's a hood. That's a sterile hood where we process the PRP so that the risk of any contamination with bacteria or fungus is essentially zero. That's important. And then on the other side, you can see we actually have what's called a cell counter right here, which we use to measure how many platelets. There's some good data that shows that if as you add more platelets to the injured area, the chances of it healing increase. There's actually interestingly, there's a number that's too big. If you give too many platelets, that's not good either. So there's kind of this sweet spot that we try to customize the treatment to your specific injury. And I think that just brings up another interesting point. We hear a lot of folks saying, well, this doctor or this clinic offers PRP. Why are you guys different? And I think the answer is the key difference is that every step of the process we take very seriously. We're very OCD about it. So, the most important thing is, do you have a condition that's going to even respond to this kind of treatment? So having that diagnosis correct. I think a lot of doctors make the mistake. They don't order x-rays or MRIs or do ultrasound. So they really don't know what they're treating. They think they're treating something that's painful, but they don't know what it is. It's critical that you know what you're treating. That's the first thing. We look at your biomechanics. We try to understand that, how's the joint functioning? How's the whole body functioning? That's, as I mentioned earlier, that's important. The methods that we use to manufacture the PRP or cell therapy, the methods that we use to deliver them, these are being injected through ultrasound guidance so we can see the tip of the needle with sub-millimeter accuracy so we know exactly where those are going. That's another way we make the procedure safe. We're not injecting into areas that might be harmful. You may not want to inject into a nerve or a blood vessel, for example. So we can see those structures on the ultrasound, and it just makes the whole procedure safer and more comfortable. And I think the other two key differences is We only associate ourselves with excellent physical therapists. So our patients are referred to physical therapists that we know are capable of executing the proper protocols for rehabilitation and are going to be great educators and help you learn how to manage your condition appropriately. And then also we track our outcomes. So we have something called Data Biologics, which is a registry where we track our patients' outcomes for years. And I think we have over 700 patients already registered in the last few years in that database. And that just allows us to collect data and tweak our protocols and make sure we're getting the best results possible.
So I've got 2 more questions, Dr. Rogers. I'll take the first question. How many injections do I need for a partial tendon tear? And as Dr. Rogers have mentioned, if your physician is skilled and experienced in doing these procedures, they know how to cater the correct biologic for your condition. And if you have the proper biologic, you will almost always just need 1 injection for this procedure. We do track our outcomes, and most of our patients do really well with just 1 injection. There may be some patients who have a more involved tear wherein they might need a booster injection down the line, but most of our patients do well with just 1 injection.
I will tell you, PRP is very interesting. Back in the days when we injected cortisone, everybody got the same drug, everybody got the same dose, and it was very predictable. PRP is more complicated because we are using your cells. And so we know that the platelet concentration can vary depending on the technique we use. You see these centrifuges behind me. We can alter our protocols so that we can increase or decrease the concentration of platelets. We know that time of day influences your platelet count. We know that your diet and your genetics influences your platelet count. Really interesting, if you run on a treadmill for 15 minutes, you can increase your platelet count temporarily by about 20%. There's all these little interesting influences that influence the quality of the PRP. Then when we centrifuge your blood, we can decide, are we going to take a little plasma or a lot of plasma? Should we take some white cells or not? So there are many things that go into that final drug, essentially, that we're manufacturing. So it's just another variable. You can't do this with a cookie cutter approach.
Okay, I think we have time for 1 more question. Have you seen favorable responses to PRP cell therapies for patients presenting with autoimmune conditions like psoriatic arthritis or ankylosing spondylitis?
Yeah, those are autoimmune conditions. Those are conditions where your immune system has decided to attack the joint, the cartilage, the ligaments, either in the spine, in the case of ankylosing spondylitis, or the sacroiliac joint, or in the small joints of the hands or the feet with psoriatic arthritis. These are slightly different processes than, say, osteoarthritis, which is a condition where the cartilage is diseased for other reasons. But in the case of these autoimmune conditions, your immune system, which is designed to kill bacteria and other foreign invaders, actually kills your own cells. And that's obviously a problem. There is good evidence that both PRP and cell-based therapies can modulate the immune system. So when the immune system is overactive, those cells can talk to them, calm them down. There is good evidence that both PRP and cell therapy can decrease inflammation, swelling, or decrease pain, and stimulate tissue regeneration. So we do see some benefit in those cases. We are not curing the underlying cause, unfortunately, in that scenario, because those patients have an autoimmune disease, which is typically managed by our rheumatologists, but we can address the symptoms and we can provide long-term relief.
One way also how cell therapies or regenerative therapies in general can help these patients is conditions wherein they have ligament laxity or very stretchy ligaments, which then predisposes someone to have unstable joints and thus more at risk for osteoarthritis or degenerative conditions. So with these therapies, we can help strengthen the ligaments and help strengthen the support structures of the joint to prevent further injuries.
And these are the common things we see. We see tendon injuries like tennis elbow or golfer's elbow. We see joint arthritis. I mean, these are the things that we see every day of the week. and have been really excited by these treatments and the results that we've got with our patients.
Well, I think
we're out of time.
that sums it up, Dr. Rogers. That time was really flew by. So for everybody who is interested in more details about these therapies, tendon injuries, spine conditions, joint problems, and the use of PRP and cell-based therapies, we do record our webinars, and we keep them in our YouTube channel. So for those of you who have missed a portion of this Ask the Doc series or our previous webinars, you can go to YouTube and just type in San Diego Orthobiologics, and you can see a deposit of all our previous webinars and sessions. Also, we do have a good resources section in our website, wherein you can, if you like reading articles, we have compiled a number of articles there that talks about all these different kinds of cell-based therapies. We also do monthly webinars so that we can go in depth. We spend about an hour talking about specific conditions and innovative cell therapies, and those we usually do every second Wednesday of the month. So for the Ask the Doc series, we'll see you again next month. I think it will be April 14th for next month, and we will be discussing a different topic then. Thank you for joining us.
Thank you.